Pauline Tully to discuss the funding allocation for the care and needs of people affected by epidermolysis bullosa.
And I wish to thank the Concordia for selecting this topical issue. Epidermolysis bullosa, or EB, is an extremely painful, rare and to many people unknown skin disease. People living with EB are missing proteins that bind the layers of their skin together, so any minor friction causes it to break and to blister. And it's debilitating and it's excruciating with no known cure. And there are 4 forms of EB that can vary in severity, but all carry their own life-limiting symptoms and lifelong pain. And EB can affect not only the skin, but also a person's internal organs. And it is therefore an extremely complex condition that in many cases requires specialised care. So on average, we have 300 people in Ireland with EB, and we recently heard from 2 powerful EB advocates during a briefing in the AV room, Emma Fogarty and Liz Collins. Now, Emma spoke about her experience of being born with a severe form of EB, and she provided a searingly honest and moving account of the ways in which her life has been affected by EB and of the pain and challenges she faces on a daily basis. And Liz likewise gave a powerful and open account of what it's like to care for her daughter with the severe EB, and explained how this disease can have a profound effect on the physical and mental health, not only of the person living with the condition, but also on their family members. And during the same briefing, we heard about a new report from the University of Limerick and Deborah Ireland, who is the patient group supporting people affected by EB. And this report reviews the impact of EB on quality of life and examines access to services and supports across 5 countries, including Ireland. So this study shows that while people with EB in Ireland do have access to care through specialist clinics in Children's Health Ireland at Crumlin and St James's Hospital, and through community health teams, and I do wish to commend the work of all of those dedicated teams, many families continue to face significant challenges in managing this difficult condition. In particular, this report from the University of Limerick and Deborah found that Ireland is lagging behind other countries by failing to provide a dedicated EB bandage scheme. It also found that challenges remain in the provision of home nursing care for people with EB, including the lack of a contingency plan where nursing staff are unavailable, and a lack of nurses trained in EB to replace those who move on. The report highlights the significant impact of EB on mental health and showed that people caring for a loved one with EB have a lower quality of life than the general population. It also found an economic burden of EB of $130,000 a year per person, including direct and indirect costs. So in their 2024 pre-budget submission, Deborah called for an investment of €810,000 in mental health supports, outreach care and home care for people with EB. So in relation to home nursing care, they're seeking ring-fence funding, as this would enable the provision of support that reflects the prevalence and impact of the disease, rather than the resources that are available where a person lives. A ring-fence fund would ensure that people with severe EB can access the essential and complex home nursing care they need, as those needs change over time. In addition, Deborah Ireland estimates that €400,000 in annual funding will be required to run an EB-specific bandaging and dressing material scheme in Ireland, similar to the one that exists in Australia. So given the significant impact of this disease, will the Minister for Health commit to providing the additional funding required to meet the needs of people living with EB in Ireland?
Thank you very much, Deputy, and I want to thank you for raising this really important issue. I think all of us in the House fully appreciate how devastating a diagnosis of a rare disease can be for the patients, the families and the carers, and I believe that there is cross-party support for doing everything that we can to help patients who live with this awful condition on a daily basis. Epidermolysis bullosa, if we've given it the full name, EB, is a rare, lifelong genetic condition which causes, as you said, fragile, blistering skin. I fully recognise and appreciate the difficulties experienced by patients suffering from this painful condition. There are approximately 300 patients in Ireland with EB, with around 60 new patients annually. Children with EB are cared for at the multidisciplinary clinics in Children's Hospital Ireland, Children's Health Ireland, Crumlin, while adult patients are treated at a multidisciplinary clinic in St James's Hospital. Care for EB requires the involvement of many different clinical specialists to extend lifespan and improve quality of life, and there has been considerable work undertaken to enhance the availability of treatments for those suffering with EB. For example, in recent weeks, the HSE published a rare disease care pathway for the diagnosis and multidisciplinary care of inherited EB. This government is fully committed to doing everything possible to assist people living with a rare disease. Significant progress has been achieved under the National Rare Diseases Plan 2014-18, including the establishment of the HSE National Clinical Programme for Rare Diseases and a National Rare Disease Office. In February, Minister Donnelly announced a plan to develop a revised National Rare Disease Plan in line with the commitment in the programme for government. Initial work for the new plan has commenced, and a steering group to progress the new plan is expected to be convened in the coming weeks. Furthermore, as part of the development of a new plan, a patient forum will be established to ensure that the plan meets the needs of patients and families affected by the rare disease. Regarding funding, following the announcement of the budget allocation for the department, Minister Donnelly will shortly be issuing a letter of determination to the HSE outlining my priorities and funding levels for 2024. This will be the basis on which the HSE will draw up the National Service Plan. It is not until the conclusion of this process that a detailed breakdown of new development will be available. I would also like, as you have done, to acknowledge the brilliant work carried out by Deborah Ireland on behalf of patients and families impacted by EB in Ireland. And I do take on board the piece you said about home nursing care and not so much a lack of training, but maybe if one nurse moves on to another job, that the continuation, it may not be there. And I suppose because it's a rare disease with 300 patients in Ireland with it, you know, I can understand the point you're making about maybe not everyone would have the up-to-date information of how to actually deal with it. But I'll certainly bring your concerns back, because I am familiar with EB myself, and I am familiar with briefings that Deborah have given previously, and I think it's great that you have people like Emma and Liz coming forward and talking out about how difficult it is living with EB.
Thank you, Minister, for that. And yeah, I do. Deborah Ireland are an excellent charity, and they provide brilliant support to people with EB and their families. But I suppose you, as Minister for Mental Health, maybe just want to focus for a few moments on mental health issues, because I just mentioned them in the opening there. But in a survey conducted by Deborah Ireland in 2019, people living with or caring for someone with EB spoke about experiencing feelings of isolation, despair, loneliness and inability to cope, and feeling of helplessness when a child is in pain, because it's excruciating pain. And when Emma was in that day in the AV room, given Deborah Ireland were in giving a briefing, she talked about every day she goes through excruciating pain. It can take 3 to 4 hours for her bandages to be changed. And when the bandages are removed, blisters must be burst, an ointment put on, and then new bandages put on. And it obviously depends on the severity of the disease, you know, how long it takes to change the bandages. But, you know, it's pain every day. So there's bound to be an impact on mental health. And a number of international studies have also examined the psychological impact of EB, and one study found prevalence rates of 63.6% for depression and 45.5% for anxiety, and a lower quality of life generally for all of those affected by EB. So Deborah Ireland do provide a grant for counselling and therapy to fill the gaps not provided by the mental health services. And they said that the demand for that grant has increased by 73% between 2021 and 2022. And I know they're looking for an investment of €80,000 per annum towards a clinical psychologist based at St James's Hospital. It would make such an impact, because it would be a person dedicated to people with EB. So I'm just wondering, Minister, if that could be something that could be considered as it's decided where budget allocations are going. Also, the EB outreach nurse, there was one appointed to the Children's Health Ireland at Crumlin, but there's been none appointed to St James's for people who move into adulthood. And that would make such a difference, because an EB outreach nurse can deliver early intervention say in the case of problem wounds, and therefore reduce the need for hospital visits to access wounds and possible infections. So again, an investment in the EB outreach nurse even would make such a difference to the people living with it. And as I said, I've already talked about the bandage scheme. It's just some of the people say about even the bandages, sometimes when they go to collect their bandages, they're the wrong size, or they're not available, and they have to travel then to one of the hospitals to get them. So it's just, there's small things that could make such a difference to the lives of people with EB and their families. Thank you.
Deputy, thank you very much. And you know, I think you've summed it up there. When you have a child living in pain every day, and it's very, very difficult for parents. As stated, the care needs of people affected by EB are currently being treated by a two-centre approach delivered through Children's Health Ireland and St James's Hospital. But I do take on board what you said, the outreach nurse is available for the CHI, but not for the adults. Also in relation to the request for the funding for clinical psychologists, which is really, really important. Currently, as I said, the HSE service plan is being configured. We support over 100 million from the mental health budget to various NGOs, and I will certainly take a look at this. I do believe, you know, for young people and adults that are living with this really, really difficult lifelong genetic condition, you know, causing fragile and blistering skin. It is very, very difficult on a daily basis. You're dealing with it every day of the week, and it can be very, very difficult. But I will bring your concerns back, and I will also look at the issues you've raised myself. Thanks, Deputy.
Now, Shingeril San Keshtan Athraula, that concludes topical issues, and we're a little ahead of time, so we'll just suspend for 3 minutes.